According to the UNAIDS World AIDS Day Report 2025, this year the global response to HIV suffered its most significant setback in decades. In early 2025, the United States, the largest donor to the global HIV response, temporarily halted the majority of its HIV-related foreign aid programs. This hit vulnerable groups hard as they could not access special care services they were receiving from donor-funded programs. Community-led organizations which had previously been able to reach the most vulnerable people reported widespread closures. In 2024, UNAIDS reports showed that globally there were 570 new HIV infections every day among young women and girls aged 15 to 24. Sub-Saharan Africa bears the highest HIV burden globally, and the World Health Organization reports that it is home to almost 65% of all people living with HIV. Now, the report warns that a failure to reach the 2030 global HIV targets of the Global AIDS Strategy could result in an additional 3.3 million new global HIV infections between 2025 and 2030. Several countries have taken action as they try to fill in the gaps left by the recent funding cuts. Nigeria, Uganda, Cote d'Ivoire, South Africa and Tanzania have committed to increasing their own funding for HIV-related health services. Organizations including the Gates Foundation, UNAIDS, the Global Fund and the U.S. President's Emergency Plan for AIDS Relief have launched initiatives to ensure widespread access to affordable generic formulations of life-saving medicines, and experts say innovations such as the twice-yearly injections to prevent HIV have the potential to prevent tens of thousands of new infections. But the gains are still slow. Today, an estimated 40.8 million people are living with HIV worldwide, while 1.3 million new HIV infections occurred in 2024, and 9.2 million people are still not accessing treatment. Wilkis Anyabwa, CGTN.
Now, more on those twice-yearly injections we just heard about that are reported to be highly effective in preventing HIV transmission. The drug being used is called lenacapavir, and it received its first public rollout in Africa yesterday in 3 southern countries: South Africa, Eswatini, and Zambia. In Eswatini, dozens lined up to get the jab at a lively event organized by the health ministry.
We've been always living in hope that someday, somehow, treatment is going to be available and the cure is at the corner.
We are here today at Ewubini, where as a program within the Ministry of Health, we are launching the lenacapavir, which is a 6-month injectable. It is an injection that will be used by both females and males. It is also can be taken by our youth. We are hoping to reduce our new infections. We must remember that from our SHIMS3, as a country, we are currently experiencing about 4,000 new infections per year.